All right, we are going to talk all about Botox today. Botox is the #1 cosmetic treatment in the history of the world. According to the American Society for Aesthetic Plastic Surgery, upwards of 5 million people undergo Botox injections every year just here in the United States. So today what I'm going to do is cover for you what are the common areas that we inject Botox into the face. So what wrinkles do we treat with it? Now, to put it simply, Botox is a neurotoxin, so it is one of the most dangerous toxins in the entire universe as far as we know. And what it does is it causes muscles to become paralyzed. And if you inject a lot of Botox, it can kill somebody. If you inject Botox in the teeniest amounts into certain parts of the face, into certain muscles of the face, it can cause those muscles to weaken temporarily and for wrinkles to become smoothed. And that's why it's become so popular, is because it works so well to do that. So what I'm going to go over with you now are the different wrinkles of the face that you can use Botox for. And I'll also talk to you about maybe some of the units that we typically use for it here at Youn Plastic Surgery. So here is a normal face, and the first place that we inject Botox, the most common location, called the glabella, or the frown lines between the eyebrows. And this is also called the 11 sign, because quite often there's just two of them, making it look like the number 11. So this is the most common area we inject Botox. It was the first area that it had a cosmetic FDA approval for. And in this area, we typically inject anywhere from about 10 to 20 units to weaken that muscle. Within about a week, the muscles become so weak that those wrinkles start to smooth out, and it does last usually about 3 to 4 months. Okay, so for any of these wrinkle treatments, you are looking at about 3 to 4 months that one treatment of Botox helps for. So that's the most common area, the glabella. Second most common area are the crow's feet. So the crow's feet wrinkles radiate out from the sides of the eyes, and these wrinkles are caused by the orbicularis muscle. The orbicularis muscle is a circular muscle that extends around the eyes, and it allows you to squint, like so. And it creates these wrinkles that radiate out as you squint. So by injecting Botox into those wrinkles, into those muscles that create those wrinkles, we can smooth them out. Now typically we use anywhere from 10 to 12 units in each side for the crow's feet. Now if you're interested, if you've got questions either on Botox or other types of cosmetic treatments, feel free to leave a comment, and at the end of this video we'll be doing a quick Q&A where I'll try to answer as many of your questions as possible. But we'll do that at the end of the video, so go ahead and comment with your questions and I'll try to get to them at the end. So the crow's feet are the second most common area we inject Botox. Works very well, anywhere from, like I said, 10 to 12 units. The third area are the forehead wrinkles. So we have forehead wrinkles which are typically horizontal in the forehead, and these are caused by the frontalis muscles. The frontalis muscles are two paired muscles here and here on the forehead that work to basically lift up your eyebrows. And if we inject Botox into those frontalis muscles, okay, and quite often we inject it into kind of a V shape, it then causes these wrinkles in the forehead then to smooth out. Now the forehead, however, Botox is the area that you have to be very, very cautious with, okay? If you've never had Botox before and you're kind of nervous to have it done, I don't usually recommend that you start with the forehead. Because when Botox is done poorly in the forehead is when people get the weird appearances that you may have seen out in Hollywood. So let me just show you on my face how that works. And feel free to get in close. Karen's taking care of the camera here. So if you've got a forehead where your eyebrows are fairly low, and if a person injects Botox across the forehead, causing those frontalis muscles to be completely weakened, what can happen is that the brow can drop. And you can get a brow drop, and it can literally look like this, and you've got 3 months before you'll be able to lift them up again, okay? So in people who have a relatively low eyebrow, if a doctor or a nurse, an injector basically injects across the forehead, you can get major brow drop, and that can be a problem. The other thing that you can get is the opposite. You can get the Botox eyebrow. So in those people who have, let's say, a fairly good arch of their brow, if you inject Botox too aggressively, in the center of the brow and not out to the side, you can get this kind of weird lifting effect where the person looks kind of angry. Okay, now you may have seen that in certain celebrities in Hollywood where they get this weird look. And so let me just show you here now on the diagram. So if you've got a person that has an eyebrow that's a fairly good shape like this, where it's not too arched, but it's not too low, if you inject Botox in a kind of a V shape, you can get that eyebrow to lift up a bit. It's a kind of an arching of that brow, okay? However, if you inject Botox coming out here and their eyebrow is fairly low, you can cause the eyebrow to drop and to look too low, okay? So really what it comes down to is Botox in the forehead. You really want to make sure, if you have it done, that that person is really looking at your eyebrow and the anatomy very, very carefully, because you can really cause major changes in how you look that you can't get if you're just doing the glabella or the crow's feet, okay? So buyer beware, Botox in the forehead, it can work really well, but you have to have it tailored to your face. If your injector does the same thing on all of his or her patients when they inject the forehead, not a good idea because you can look quite odd afterwards. So these are the three most common areas that we inject Botox into the forehead. Number one being the glabella, then the crow's feet, then the forehead region. Once again, we'll be answering questions at the end of this video, so feel free to comment with those questions and we'll try to go in the order that they are received at the end of the video. Well, what about the rest of the face? Where else can you inject Botox? There are some doctors that will inject a tiny bit of Botox right here and here in the eyelid. I don't do that. The idea is if you inject the smallest amount in the eyelid, you can cause the eyes to open up a little bit. I know a dermatologist in Beverly Hills taught me how to do that, Dr. Zain Obaji, and that was one of the things that he likes to do. I haven't done that in my practice so much. Where else can you inject Botox? If you inject Botox into the area of the nose up through here, you can treat what are called bunny lines, okay? And you can even go off to the side of the nose to treat wrinkles that happen in this area that we call the bunny lines, as well as those horizontal wrinkles that you can get across the nose. If you inject Botox there, usually just a few units, you don't need a lot, you can really help to smooth those wrinkles out also. As we go down the face, where else can you inject it? Well, there are people who have wrinkles around the lips that they don't like. And so some injectors will inject a bit of Botox around the mouth. Not my favorite treatment, okay? Botox weakens muscles. And the reason why you develop those wrinkles is because of the pursing action of your lips. You know, it's when you kiss, when you drink out of a straw, that type of thing. It's a very, you're kind of like, what do you call it? You're really trying to thread the needle, I guess that's probably the best way to describe it, when you're injecting Botox around the mouth, because if you inject too much, then the person might drool when they drink out of a cup. If you inject too much, they may not be able to smile or kiss or drink out of a straw. If you don't inject enough, then you just don't see much of a change. And for that reason why, in my practice, we don't really inject around the mouth in that manner, because I don't want there to be a problem with that. Because who wants to be drooling when they're out to dinner with somebody? A great place to inject Botox is right here and right here. So for people who have something that I have, which is a bit of a permanent frown, where the corners of the mouth droop down, if we inject just a tiniest bit of Botox, about 2 units or so, under each corner of the mouth, you can lift the corners of the mouth and turn that permanent frown upside down, and it can actually lift the corners of the mouth. Very nice treatment, small amount of Botox. You don't need much, very, very small amount, and it can help lift those corners of the mouth. Another area that people inject Botox is the chin. And there was a story that circulated years ago that Gordon Ramsay, that famous chef, had Botox injected into his chin to decrease the wrinkles of the chin. I haven't done that before. Honestly, it sounds kind of dumb to me, so I don't do that, but that is another area that people do it. Also, gummy smile. If you inject Botox right here and right here, just to the sides of the nose, for those people who have a gummy smile where the upper lip lifts up too high, it can drop the lip a bit and reduce the gummy smile. And typically you only need a few units on each side to do that injection, okay? So those are the main wrinkles of the face that we typically treat with Botox. One final area that we do all the time in my practice is quite often we inject Botox into the masseter muscles. So the masseter muscles are the muscles that are on the side of your jaw. So when you clench your teeth, you can feel that muscle right here on the side of your jaw. In those people who chew a lot of gum, people who grind their teeth a lot at night, a lot of Asians have it, just I think it's genetic, we can get overgrowth of that masseter muscle out here and out here. And when that muscle overgrows, it makes the jaw look a bit wide. So if we inject Botox into that muscle out here, and usually we have to start with a pretty good amount of Botox, anywhere from 20 at the least to 35 units, typically at the most, into that muscle. If we inject into that muscle, we can cause that muscle to atrophy with time and to actually get thinner. And so the idea then is you take somebody like this who may have a bit of a rounder, fuller face here. By injecting Botox, you can help to recontour their face to make it thinner. Okay? So instead of having a rounder face through here, now you can actually help thin it. And a very cool use of Botox. It started back in, out in Asia, gosh, maybe 15, 20 years ago, where in Asia, especially in Korea, where my ancestors are from, there's a lot of this overgrowth of this muscle. And so plastic surgeons would go in and actually shave that muscle down. It was a bloody operation. And once Botox came around, they started injecting it into that muscle. We brought that down, and so I was one of the first people here in the state of Michigan to inject Botox for that. Just because I'm Asian, I thought, hey, you know, I should know how to do this. And now a lot of people are doing it, a super cool use of it. So these are the different things for Botox, treatments for Botox. It is a great treatment. It's the most popular cosmetic treatment in the world, the most popular cosmetic treatment in my office. Works great, but it is expensive. A vial of Botox costs a practitioner like myself literally $600 for this. And if you open up this box, it's the tiniest bit of, it just looks like a little bit of, gosh, powder at the bottom of a vial. $600. Crazy, isn't it?